Can you test for Tay-Sachs disease? Are you curious about whether you can test for Tay-Sachs disease? This hereditary condition is important to understand, especially for families with a history of genetic disorders. Tay-Sachs disease is caused by mutations in the hexa gene, which leads to a deficiency of the enzyme hexosaminidase. This deficiency can have serious health implications. Testing for Tay-Sachs is indeed possible, and there are two main methods used. The first is enzyme activity testing. This test measures the activity level of the hexosaminidase, an enzyme in white blood cells or serum. If the enzyme activity is low, it may indicate that a person is a carrier or affected by the disease. This method is often the first step in screening, especially in populations that are at higher risk. The second method is DNA-based genetic testing. This involves sequencing the hexa gene to look for specific mutations that cause Tay-Sachs. This type of testing is highly sensitive and can identify most harmful variants across different ethnic groups. Many healthcare providers prefer this method for carrier screening because it offers detailed information that can help with genetic counseling and family planning. Carrier screening is particularly important because Tay-Sachs is inherited in an autosomal recessive manner. This means that for a child to be affected, both parents must pass down a defective copy of the hexa gene. If both parents are carriers, there is a 25% chance with each pregnancy that their child will have Tay-Sachs disease. For those who are pregnant and at risk, prenatal testing is available. Techniques like chorionic villus sampling can be done around the 11th week of pregnancy, or amniocentesis can be performed around the 16th week. These tests can check the fetus for Tay-Sachs mutations. Couples who are carriers have options to reduce the risk of having an affected child. Assisted reproductive technologies, combined with genetic testing of embryos, allow for the selection of embryos without Tay-Sachs mutations. This is known as preimplantation genetic diagnosis. Testing can be done using various samples, such as blood or saliva. Recent advances in technology have made it possible to conduct highly accurate carrier screening using saliva samples. However, in some cases, enzyme testing with blood may still be recommended for more precise results. In summary, testing for Tay-Sachs disease can be done through enzyme assays and genetic sequencing of the hexa gene. These tests provide essential information for families regarding hereditary health risks and help in making informed decisions about family planning.